Tonight on KQED Newsroom, coronavirus cases are on the rise across California with more and more infections among younger people. Plus, the challenges facing the San Francisco Zoo and the Oakland Zoo, where animals still need care and feeding even while the gates remain shut. And how scientists are collaborating across borders to fight COVID-19. We talk with researchers in California and Bolivia about their pioneering solutions. Welcome to KQED Newsroom. I'm Priya David Clemens. Public health officials had hoped to see fewer coronavirus cases now that it's summer, but instead, cases are on the rise across the globe, the nation, and here in California. At first, seniors and those with compromised immune systems appeared to be hardest hit. Now, young people are making up a far larger number of those falling ill. Since the beginning of July, 65% of new cases in California are among people between the ages of 18 and 49. That's despite the fact that less than half of Californians fall into that age range. Joining me now by Skype to help us understand what's behind these numbers is Dr. Kirsten Bibbins-Domingo, the chair of the Department of Epidemiology at UCSF and also a practicing physician. Dr. Bibbins-Domingo, thank you for joining us.
Thanks for having me.
Let's talk about the fact that the age of infection seems to be dropping pretty drastically. Why is this? Is it related to reopening?
Yeah, it's a great question. I think nationally we see that the average age earlier on in the pandemic was about 65 for cases, and now it's some reports as low as 35 as the average age of cases. And we've seen that shift downward that has come with reopening. I think there are probably two big ways to think about it. One is that we asked older people to stay home. We said you're more at risk for severe outcomes from this type of infection. And so when we reopened, older people did stay home. And it's the younger people who went out. And they went out and probably did two big types of things. They went out and worked, and that's what we asked them to do. And they went out and had a good time. And I think the combination of those two things are where the riskier activities have been. And I think the reason the younger people is just because they're the people we said you can go out and help us reopen the economy, and that's why they're at risk now.
And youth still does seem to confer some protection. The younger people who are getting sick are not getting as sick as people who are older, and they're certainly not dying at the same rate. Does this mean if you're younger and you don't need to worry as much about catching the coronavirus?
Yeah, I think an important message here is that every age can be infected with this virus, and every age has the possibility of having a severe course, including a severe course that might lead to death. We've seen deaths, we've seen severe cases in younger people. It's just that they don't occur as commonly as in older people. But here's the numbers game. Now that we have many, many more cases in younger people, we are also seeing that some fraction of them are ending up in the hospital, and some, I believe, might have more severe outcomes. It's important to know in California that even though the cases are in younger people, we are seeing a rise in hospitalizations. That's more severe disease. And we also, I think, are starting to see a rise in deaths. So I don't think we can get complacent about this.
Do you think that this is the worst it's going to get in California?
Well, here's why I'm in general optimistic, but why we have to be cautious. I'm optimistic because California was really great at the beginning of this pandemic. We were really great in the Bay Area in shutting down our economies, in sheltering in place, in really paying attention to all of those things. And that's why we were really good at flattening the curve. I think the problem is shutting down was easy, but opening back up is hard. And opening back up is hard because we all need to do our part. That includes masking and all of these other things that we have to do, and also paying close attention to those areas that put you at risk for higher risk of transmission. But right now, we are in the middle of an uptick of cases, an uptick of hospitalizations. We're in a very delicate and dangerous time right now, and this is the time we have to really redouble our efforts to get this back under control.
Wasn't there the thought that once we reopen, we would be seeing more new cases, and that by this time hospitals would be able to manage more cases? Why are we then retrenching and closing down sectors of the economy again?
That's such a great question. So you're absolutely right. Part of this was that we don't want to have an overload of cases in our hospitals like happened in New York. And I think, frankly, even though we've had an uptick of hospitalized cases in California, we are not at that critical point because we've been able to redistribute them across the state of California. We did expect to see an uptick of cases, but not nearly the rate of rise as we're seeing now. We have a positivity rate, the number of tests that turn up positive, that's continuing to rise across California. It's definitely in that danger zone. And that's really concerning, and we do have to pay attention. I would say two things that we probably didn't do as well as we probably should have. One is that we failed to realize that as we went outside, we had to trade that protection that we got from sheltering in place to protection that we need when we're out in public. And that protection really is masking. So the universal masking all the time when you're out. The second big area, and I think this is one we're really starting to appreciate even more now, is how indoor environments really are where there is great risk. And we've seen this in the retrenchment now of taking back that we can dine indoors, that closing the bars, and also importantly, making sure that gatherings in somebody's house or in another private indoor environment is limited to a smaller number of people. I believe Santa Clara just banned those types of indoor gatherings. Indoor environments are particularly challenging environments because we're learning from the World Health Organization that the virus stays in the air. And so in closed environments, especially when you have the mask off because you're eating or drinking, that's a risky environment. And that's what you're seeing in start of this, the move by most of our counties now to take back indoor dining and bars and restaurants.
I want to turn now to testing. You've been involved in coordinating the testing happening in the Bay Area and different locations. A very specific test that was happening in the Mission that was targeted, and there's going to be another one that's coming up in Oakland like that in the Fruitvale district. Why does it seem that testing is still scarce, that those resources are still not as available as they should be?
Yeah, I think California has done a great job in making tests available and in our Bay Area making tests available. But what we see is a mismatch of where testing is. And so we know in the Bay Area and across California that our Latinx community has been particularly hard hit with this virus. We know that African American and Pacific Islander communities have also been hard hit. And what we have seen in our own experience at UCSF is that it's very important to actually take testing directly to the communities affected. There's sometimes fear about testing. There's sometimes concern about cost of testing. There's sometimes fear about contact tracing and other people being involved. And so what we've done in many of our testing studies in the Mission, in D10, in the Bayview, District 10, Bayview and Sunnydale, and what we hope to do in Oakland is really testing in the communities in a sort of community fair type of atmosphere that's really brings people out. We work very closely in partnership with community-based organizations to really build trust and to make sure that we're following up the people who've tested positive, because that's also another barrier that leads many not to be tested.
In the last few moments we have here together, if you were going to shake your crystal ball, what is the scenario that you see playing out over the next 3 months? Do you think schools will be reopened?
Yeah, I think in the next 3 months, if I look at California, I feel optimistic that we are a state that can get back to where we were at the beginning of the pandemic if we understand and help all of us. This will require our leaders, everyone who lives in California, to do their own part to get us back under control. And then I think we're going to have to reevaluate the state of the science and the state of what our resources are to say, can we reopen schools safely? Can we reopen colleges and universities safely? If we have some businesses opening, how do we assure that the workers in those businesses at every wage, including our low-wage essential workers, are safe when they're there?
All right.
And I think if we do that, we can get back to where we were.
Dr. Kirsten Bibbins-Domingo with UCSF, thank you so much.
Thank you.
Let's turn now to two long-standing Bay Area institutions. While most California zoos have been permitted to reopen their outdoor areas, here in the Bay Area, the Oakland Zoo and the San Francisco Zoo both remain closed. Behind the scenes, the zoos continue to care for their animals and maintain their grounds, but the lack of visitors has put a drastic hole in their budgets. Both zoos have received funds from the Paycheck Protection Program, but that federal money is running out, and the zoos now face the possibility of closing forever. Joining me now by Skype is the CEO of the Oakland Zoo, Dr. Joel Parrott, and CEO of the San Francisco Zoo, Tanya Peterson. Thank you both for joining us.
Thank you for having us.
Yeah, thank you.
Tanya, this week, the San Francisco Botanical Garden announced they had more than 50,000 visitors last month. They've also opened up their youth camp. What is so different about a visit to the Botanical Garden than the zoo?
Frankly, I see no difference, especially under our reopening plan, where we are going to keep all outdoor spaces open, but nothing indoors. The Botanical Gardens is beautiful, but 50 acres. We're nearly double that at 100 acres. I think we can open as safely with less people in a controlled manner.
Dr. Parrott, tell me in a nutshell, how bad is the financial picture for the Oakland Zoo?
Well, it's just a matter of numbers. And so what we have is, by the end of this month, we'll have about $3.2 million left in our reserve, and we burn about $1 million per month. So we have about that much time. We're on that trajectory to use up our reserves.
And Director Peterson, what about for you? How is your financial picture?
We're probably just a couple months behind the Oakland Zoo. We have not started to use our reserve, thanks to our community of both major donors and city partners. But I think there's a frustration from our donors and our members as to why we're not opening.
What is the holdup? What do you understand about why you are not opening?
Frankly, I have no understanding why. Once outdoor museums were open, I thought we would be ready to open. We're hosting zoo camps, childcare for essential workers. We are on an ocean. We are, again, outside in a suburban setting. We serve our local community and our local families. I really have no understanding why we're not open.
You know, I reached out to the San Francisco Department of Public Health this week and asked if they'll permit the San Francisco Zoo to open, and if not, why not? I received a one-line response, which said the date of the San Francisco Zoo reopening is still pending. I followed up asking why it was pending and have received no response. I've also received no response from the Alameda County Department of Health about the Oakland Zoo reopening. Dr. Parrott, are you experiencing this same lack of information, the same red tape?
No, actually, our Alameda County Public Health Department has been very supportive, as have the county supervisors. But what we're getting caught in is a bureaucratic language, because the state said that they basically said that zoos are in stage 3, but outdoor museums were stage 2. So if they classified us as an outdoor museum, we could open. If we're held to zoo, they're still waiting for an application for attestation, which is then permission to let the zoos open. So, but it's the same. How are we different from an outdoor museum? That's what Tanya and I have been dealing with, that it's just a state classification. And meanwhile, we're running out of reserves.
And Tanya, what about for you? You have actually gotten that attestation, correct? But you have not been able to move forward.
That's exactly right. And we have the support of our Board of Supervisors. We've got Starbucks and other retail units open, so why not the zoo still is perplexing to me.
Joel, I understand that you're both concerned about the lack of the zoo opening and the financial situation of your zoo. However, at the same time, neither of you want to become a vector, and so you're putting safety measures into place to make sure that when visitors come, they can have a safe experience. Joel, could you start with telling us about the Oakland Zoo and some of the measures you have put into place?
I'm really glad you asked that, because what's important to all of us is that in no way is a visit to the Oakland Zoo going to transmit the disease. So we're basing it on science, and the science says that it's being transmitted person to person, primarily indoor, large group, and for a prolonged period of time. So when you come to either the San Francisco Zoo or the Oakland Zoo, you're outdoor with your family group, and you just briefly pass anybody along the pathway. If you add on to that the requirement of masks, and social distancing, and we do hand sanitizers and disinfect throughout the day, the risk of transmission at the Oakland Zoo, no matter how many cases are out there in Alameda County, the risk of transmission is minimal.
And Tanya, what about at the San Francisco Zoo? Have you been taking similar measures? Anything different?
Oh, absolutely. In fact, before the shelter in place, our animal staff teams were wearing masks. At that time, we were concerned about transmission from animals. We were already creating greater distant path between visitors and animals to that respect. We've created a timed online reservation system. So you now have to have a reservation just like you would have to at a restaurant to avoid congestion. We've created a one-way path. And we're really opening up all 100 acres, so there's plenty of room for families to move around easily and safely throughout the zoo.
Joel, if you cannot come up with the necessary money, if you cannot reopen, what will happen to the zoo?
Well, it's a city facility, so it's a city-owned facility managed by a nonprofit organization. If our reserves run out, it's basically management is transferred back to the city of Oakland, and then it's their responsibility to run the zoo.
And Tanya, the same in San Francisco. What are your thoughts about how that would happen and what the management of the zoo would look like if it was transferred to the city?
Well, we took over management in 1990 because we all recognized San Francisco Zoo and Gardens needed to improve and move forward. I think it was Mayor Willie Brown who said politics should stay out of zoos. We spent millions of dollars, hundreds of staff hours to move the zoo forward. And I fear without substantial aid, we'll be going backwards to those old zoos of yesteryear that no one wants to see again.
What will happen to the animals if the zoos do need to be turned over to the city or to close?
They would basically, the city would have to find homes for them, and primarily in other zoos. But we have 750 animals. There's no way all of them would be able to be where they could find a home for them. The main reason is because you get certain species like when you get a geriatric animal and you're trying to reintroduce a primate to a group, the social dynamics won't allow it. So there's a reluctance, in other zoos to take social animals that are geriatric.
And Tanya, how are the animals doing now without visitors there?
The animals are thriving thanks to the animal support team, but I say that they're lonely. When I walk around, our primates, the chimpanzees, the orangs, come out immediately, start blowing me kisses. The penguins follow me, the rhinos follow me. I mean, we as people provide them enrichment and curiosity, and they're definitely missing us.
Dr. Joel Parrott with the Oakland Zoo, Director Tanya Peterson with the San Francisco Zoo. Thank you both so much.
Thank you.
Thank you.
The coronavirus pandemic is a worldwide crisis, but it's also fostered increased collaboration between scientists across the globe. At Stanford University in the heart of Silicon Valley, researchers are looking into creating low-cost ventilators, face masks, and other personal protective equipment. Many of these innovations are being rolled out around the world, including in Bolivia, where scientists are working on a coronavirus testing kit that requires no electricity. As researchers race to diagnose, treat, and prevent the virus, they're also learning new ways to work together. Joining me now by Skype is Stanford University bioengineering professor Manu Prakash, who is also a 2016 MacArthur Genius Grant recipient. Dr. Prakash, thanks for being on the show.
Thanks for having me again.
We did talk with you a couple of months ago when you were innovating some new technology. Can you bring us up to date on your new mask and tell us about your pufferfish ventilator project?
Yeah, I think as we talked about last time, new mask at this point has been approved from a regulatory structure in several countries in Europe, and it's starting to scale. I wanted to mention some amount of work that's gone in on pufferfish, which is our open source hardware design for a full-featured ventilator. This is a partnership between 3 universities across the country, Brown, Stanford, and University of Utah. And we have tried to build together a full-feature ventilator that has all the sets of medical requirements to try to support a COVID-19 patient. but do it in a context of a global collaboration with manufacturing partners in India, Kenya, Nepal, Chile, to really bring the capacity to do ventilators across the world in a manner that can scale as the needs, global needs are starting to rise.
We've heard from some scientists, you included, that the pandemic has brought about an unprecedented international scientific collaboration. Can you tell us about some of the projects that are being worked on now?
We've looked at all the work that we've been doing as teams to make sure that it's openly accessible, and how do we support teams across the world in bringing these ideas and products to the market through the regulatory process in those specific countries. We are literally on Zoom calls with international partners between 10 to 15 countries on a regular basis to try to essentially outpace the growth at which the virus has now caught on in the global south.
I'd like to turn now to a project that allows for COVID testing without electricity. You're conducting this project in the Amazon region with a local partner, and we're fortunate to have that partner, Dr. Erica Alandia Robles, join us from Bolivia now. Dr. Alandia Robles is the coordinator for the Next Cap Foundation. Thank you so much for coming on the show.
Thank you for the invitation.
Just yesterday, Bolivia's interim president announced she has the virus. Earlier in the week, the president of your neighboring country, Brazil, also announced he has COVID-19. Can you describe the toll the virus is taking in your region, with particular focus on your indigenous groups?
Okay, yes, here in Bolivia, for instance, we have at the moment more than 44,000 positive cases of COVID, and 600 people who died with the disease. So it's to be worried, since we share a big border with Brazil, where cases are also pretty important, and especially we share the Amazon region, the most important border that we have. And for the indigenous groups, we really don't know how many cases we have, but an official report says that we have more than 150 indigenous people who are sick, and at least 30 who died already. But we don't know the real situation, since they are remote areas, especially the ones located along the rivers, where we don't have reports. So it's complicated.
And this project will hopefully help to bring COVID testing to those regions. Professor Prakash, can you tell us a little bit more about this device?
Yeah, I think we have been working on this idea of converting and building an electricity-free COVID test, which could be conducted in the middle of nowhere, say in the Amazon itself. We call it handifuge lamp. What you're seeing is essentially a type of a centrifuge that we in our team built from sets of parts from a toy that my kids had found some time ago from a flashlight. What we've been able to do is demonstrate that using sets of assays that were first developed by a team at Harvard and New England Biolabs, how to take those assays and convert that assay into a completely electricity-free test that can be done with saliva only. And so this now allows us to really take COVID testing to the remotest parts of the world. The sets of places where resources are extremely limited are completely out of tests. And this is when we partnered with Erica and her Next Cap team, because we would like to ensure that the tests should be widely available no matter where you live.
Dr. Alandia Robles, can you tell us about how these tests will be diagnosed, how the research will be conducted, and how they will be deployed?
Okay, so in a first instance, what we want to do is to validate the tests using positive samples, COVID positive samples, that we want to work with one of the reference labs here in La Paz City. So we're going to validate that under laboratory conditions, and afterward, we want to do it in the field, in the Amazon, where there are at least 4 indigenous groups living close by and depending on the local hospital.
What are some of those challenges of bringing these diagnostic tools to these tribes, and how is the acceptance?
Well, I've been working for many years already with indigenous people, especially the Takana indigenous people for more than 12 years in different health projects. Also with the Chimane indigenous groups, so there's a good acceptance since we know each other for many years, and this is a big advantage when we work with these kind of groups. No? But it's also the local people, I mean, not indigenous people, who is at risk. So the experience of working there for many years is going to help us and reduce the problems to work in those areas. Because the access is restricted at the moment.
Dr. Prakash, can you tell us a little bit about the learnings working internationally in this way? We know you've done it some on previous projects as well, but what has this experience of fighting the pandemic been like for you?
I think the biggest thing that we think about is we are trying to reinvent how technology transfer happens around the world. When you're talking about reacting to such fast changing, all of the COVID projects that we have chosen to work on are under the open hardware CERN license. So that allows manufacturers and industrial partners to engage rapidly. And I think to me, the joy in the act of delivering this science is to really meet people like Erica who have spent their entire life in the sets of communities and understand deeply the challenge. So I think personally, it's been quite valuable to engage early in the phase, as you're seeing in this project, but also with the pufferfish, the sets of partnerships that we've created in Kenya and Nepal and India to really roll out that product has really been informative in our, many times when we do research, there is a very serial nature to be thinking about how these sets of products would be deployed. And we've had to put that right in front and center because if we can't deliver these innovations to people that need them, then, I'm not so sure whether we are actually helping.
Thank you so much for your time. Dr. Erica Alandia Robles with NextCap and Professor Manu Prakash with Stanford University.
Thank you for having us.
You can find more of our coverage at kqed.org/KQED Newsroom. I'm Priya David Clemens. You can reach me on Twitter, Facebook, and Instagram at Priya D. Clemens. From all of us here at KQED, thanks for watching.